different profession with me today. A doctor in the house. One of the top doctors in Goa, a surgeon. Mr. Pawan Rane, welcome sir.
Hello.
Welcome doctor, I should say to you.
Yes.
Nice to have you on the show. Yeah.
Thank you for having me.
Yeah.
And it's a pleasure to be here and to see your accomplishments and see, it's an inspiration to see all this. So I'm glad to be with sir.
It's okay, you don't have to call me sir today. He has been part of a team where I've been mentoring. So he calls me sir, he's a big man. Please tell us and everybody your particular profession, because I'm not that good in elaborating things. Let us know in detail what you do in life.
Right. So I am a ear, nose, throat surgeon as a basic specialization, and then I have done my training in head and neck cancers.
Okay.
So I have trained in the prestigious Tata Memorial Hospital in Bombay, and I have trained in management of all cancers of the head and neck region. So after that, I have trained additionally in management of thyroid in robotics.
Specialist.
Yes, it's a super specialization in thyroid surgeries. We do robotic thyroid surgeries. I've trained that from Korea.
Okay.
And
so you had to go to Korea for that?
Yes.
Okay.
And I had also gone to US, I was in Sloan Kettering, which is one of the best cancer hospitals in the world. I'm with one of the few top head and neck surgeons in the world. So with them, and then you bring that all back to Goa, and it's been the last few years now I've been practicing in Goa. So I'm originally born and brought up in Goa. I've done my schooling, my MBBS, my post-graduation, everything in Goa, and then trained at
different places around the world to get the best thing.
Yes, and then I've come back to my homeland, that's Goa, and I think I'm serving here.
Okay, so currently you're with Healthway, I guess. And plus you're doing other, you're at different places.
I have my own clinic in Panjim.
In Panjim you have your clinic, okay.
And then I consult at Healthway and I consult at different hospitals.
And your operations take place at different hospitals?
Different places.
Okay. Yeah. Tell us something, you are such an athletic kind of a person. You work hard, you've been a boxer, I guess, you've been an athlete, and you're a runner, you play cricket. And that's how I know you. That's luckily I came to know across you. You must be doing this doctor thing. How it started in your life? When it came to your mind, because I have not done to this profession. And doctors, we say that from childhood they decide to become a doctor.
No.
So when did you decide all this?
Right from childhood, I've had a passion for sports, all types. So I like to play chess. I'm in football, badminton, and I was in cricket.
And boxing also, you said?
Cricket, yeah. This was right in childhood. Then, as you reach college level, I entered boxing. I've played a state tournament. I've been a gold medalist in boxing as well.
Wow.
After that, and that was doing MBBS. So, used to come every day with one injury to the face, and used to be on bruising around the eye, broken nose, swollen lip. After a while, you realize that boxing does not go with medicine. So you get injuries. And on the face, if somebody is hurt like this, patients also don't appreciate you. And above that, what used to happen, I used to get injuries on my wrists and on the knuckles and all. So your surgical this thing and all used to get a problem. So then I shifted from being a boxer to going into
cricket?
No, as a doctor for boxing this thing. So I've been a ringside physician for multiple national games. I've been a ringside physician for the Commonwealth Games as well in India.
Wow, very nice information there.
So then cricket has been the primary passion. It's every boy's dream to play cricket and represent at top level. But cricket has never been encouraged at home. So they've always been they've always been that sports is secondary. You do your studies first. So managed to get into MBBS. That time everything is slowed down. Once you finish your studies and then you get into a work, then that time again you are back to your you've done your studies. Now what else do you need in life? You want to get back to
cricket. That was during the 12th 12th or by the
10th,
completed
11th,
10th,
12th, and then
you
12th,
decided that I'm going to
yes.
line of doctor.
Yeah, that is where it happened, and luckily I got some good marks which could enable me to enter medicine.
Wow.
And then it was from there it went into.
So you entered Goa Medical
I was
College
a
only.
cricketer first and a doctor second, so it's like a cricketer who is
Don't say
also a doctor.
You
so
see,
like that kind of a thing.
I don't accept that. You are one of the top doctors in town and in the state, and you went to medical college. Yeah.
Yes.
Okay, how many in the family? How many brothers?
I have a younger brother.
Okay, he's also a doctor.
No, he's a computer engineer.
Okay.
He was in Bangalore
Okay.
for most of his post his training.
Okay.
But now he's back to Goa and they stay in Margao and he's married. He also.
So you're all together. You're in Donapala, in the
Yes.
this side and in North Kenya. You studied there and then you started your medical college. You came out with flying colors and you were lucky enough to go in different educational system of medical and then you became a doctor. What was the feel to be a doctor at that time? No, ultimately you achieved what you, or you were still hungry to go big.
Yes, when we began studying, there is an artful culture in MBBS is to absorb information. You have to keep absorbing because the training is very, very intense. So right from first year we had like every week 2 to 3 tests and exams. Like
Okay.
so there's something called as ward living, there's something called as part viva, grand viva, everything every week or something. First year it was very intense, and then you have clinical postings from second year and all. There you get trained to talk to patients and how to get information from them. So all this first initially you are completely into the theoretical part of it as you begin, and then you slowly get into the practical part of it. So once that tag of doctor comes in, that is after finishing MBBS, you're like this is an achievement, a grand achievement kind of a thing. But overall, if you go to see, you don't know much still, because just doing MBBS doesn't mean that you know much about everything. So you still need to train yourself, you need to learn. And when you enter the post graduation and you realize that every particular specialty is a full lifetime of information. I have entered ear, nose, throat. Now, ear, nose, throat was huge. And our main textbook is having 7 volumes. So that was the way the thing was, and then when you go into each specialty, now ear, nose, throat, ear specialty also has subspecialties, like there's otology, there's neuro-otology, and then in rhinology there is nose, sinus surgery, skull-based surgeries, and you go into head and neck, which requires cancers and all, then you go into laryngology, which goes into voice, goes into those kind of surgery, and the expansiveness of it is too much, it's overwhelming. So you have to then go and train little and try to learn more about one thing. But the core has been that keep learning. Now I'm been bothering you many times, like how do I do? Sir, don't worry now, don't do, sir. Say, don't do.
Over practice.
Don't overdo. Just go step by step, you'll improve. So that has been the thing, always do more.
So when it came to your mind that I'm going to choose this specialty?
So when I finished my MBBS, so then we have to get into the list of getting into further training. So the options were to get into small surgeries like ophthalmology, get into the anesthesia branch or medical branch. But I have always been a surgical person. I always wanted to do hand work when you do surgeries.
Wow.
So the options were like getting into orthopedics, which was already flooded. General surgeon requires additional multiple trainings, because general surgery is still a general surgeon, then you have to be specific surgeon. So the idea was to get into something which is end branch but gives you enough patient load, it gives you enough quality work, at the same time gives you good, because you don't want to be in a very intensive field where you are only seeing emergencies. So because that also becomes very much stressful and exhausting. So now the thing has been that to go to a specialty where you learn everything and you can directly begin practice very quickly. Because if you go into certain specialties, it requires a big setup. Like cardiothoracic surgery requires a huge setup where you have to invest like 40 lakhs, 50 lakhs to build even the basic things. But for a ear, nose, throat, you can get into the core setups and join hospitals. So that was the logic. But that's not the only logic, that is the technicalities. And like you also have a need to operate and you need to give satisfaction, give good results to the patient. So surgery was my area of interest. So there are a lot of patients who like, a lot of doctors who like medical branches, which are like, you see the patient, you diagnose, you give medicines. But I was purely for surgical. So that was my aim. Then after entering there, I wanted to train with the best people. So in India, the best place was Tata Memorial Hospital. So you trained there with like reputed big Anil De Cruz, Pankaj Chaturvedi, they're like huge names in head and neck cancer surgery. So trained with them, then trained with international doctors.
Wow.
So in Korea, there have been some doctors, Dr. Lee, Dr. Koi, both of them are huge names in thyroid surgeries in the world. So and then we have trained in something called as robotic thyroid surgeries, which is a latest form of thyroid surgery where we use a surgical robot and operate. So I would like also to say that the new surgical system of CMR, which has come.
What is CMR?
It's a surgical robot.
Okay.
So like the existing robot was called as Da Vinci system. Now
Okay.
this was a new system which has come. And the world's first thyroidectomy ever performed on that system I have done in Goa.
Oh wow.
World's first.
Okay, so you all also have first and records to be maintained, like cricket.
So
You also have that.
it's not record as such, but
Of course, it's the first thing to happen.
it is, yeah, because on that system, they had designed that system first initially to do abdominal surgeries and gynec surgeries and all, but nobody had ever done a thyroid surgery on that system. But the principles remain the same. As you are trained on a different surgical system, it's a new surgical system.
So you were the first on that.
First one.
So if anything happens further down on that, people will come back to you for any reference or something.
Yes. In fact, they have decided to have me as the trainer for other doctors.
So already you started getting into that professor kind of a thing or training kind of thing in colleges. You go as a senior.
Yeah, I will go as faculty at different conferences. You go as faculty at different places.
Wow.
You perform live surgeries to demonstrate to students.
What's your age, Pawan?
I am going to be 40 now.
40 years. I can't believe this. 40 years is a genius already, and we have it in Goa. You got into this facility and then you started your own clinic. How good is your clinic placed at the moment now?
So the clinic we began primarily because me and my wife.
What's the name of the clinic?
It's called Spectrum Clinic.
Spectrum, it's located in Banjul.
It's located in Santinis, Panjim. My
Okay.
wife is a eye specialist, so
Okay.
she's super specialized in children's eyes, so pediatric ophthalmologist.
Okay.
So the idea was to have a combined clinic.
Okay.
So she and me both sitting in the clinic. We have a
Wow.
Yeah.
Okay.
Then we have the audiology unit and the optician and everything together.
Your clinic is equipped for anything, surgery, no?
No. It's
But attending the patient.
yeah, outpatient clinic, but so we only see.
And then you can guide them to
guide them to a hospital for testing or lab for testing, or you go to a close by hospital or a bigger hospital for surgeries. That's
So doctor, your wife is doctor.
Yes.
You are a doctor. So it was all in set up since the college days, and how it happened?
Yes.
Yeah.
It is. It has been. She was my junior in ophthalmology. I was in ear, nose, throat. That's how we met, and that's how we,
You all got together.
Yeah, we got together.
So doctors mostly, I have noticed this happens, and mostly the doctors get on along well with doctors only. They are not. Mostly I've seen this. Most of the couples, not only in Goa, all over the world, doctors have that understanding with doctors.
Yeah, I think it's more about understanding because how you
the pressure.
Pressure plus your the world which you are in, like other people do not easily understand. So it becomes very good when the other person also knows that what is surgery, what is this thing, what is going and seeing rounds, what is seeing patient, what are the complications which can happen.
Wow.
Because nowadays the thing is like people expect doctors that you go to him and he treats you like there's an algorithm and he gives you medicine and everything becomes okay. It doesn't work like that. Everyone is complex. Things work differently. There are things which go bad and things which go good. There are sometimes when patients get better when you don't do anything. Sometimes you need to treat, sometimes you don't need to treat, and sometimes after doing everything, you still, in cancer especially, we still lose patients after doing everything right as per international guidelines. So the thing is, human body is too complex for everyone to understand, and anyone cannot understand so many things. And all guidelines are guidelines. Overall, things will work sometimes, things may not work sometimes. So that's a little complicated.
You are handling one of the biggest threats to lifeline, life, you can say. And that too in India, especially throat, which had a very bad history, and it has come back to very better.
Yes.
From the tuberculosis days to the
Yes,
cancer
yes.
days, it has come back to good now.
Correct.
And still, it's still worse. People are still into throat cancers and this thyroids and a lot of things. So, how do you handle that pressure of being a kind of, at times, a kind of a god to people, because that's how the people think. It's not for you to decide.
Correct.
If the people coming to you, like they know the big name, how do you handle that kind of a pressure?
So one is the training, because you have trained at places where you see 3 levels of complexity, and compared to what you see in Goa and in a local place. You handled patients which are like operated 5 times and you still given them good result. So when you see a patient who's operated, who comes new, you have that key, I will give the best result as per my capability, and hoping that following all the latest guidelines, let's hope that this patient will do well. So we see a lot of mouth cancers, we see throat cancers, sinus cancers. These are all now because of smoking, tobacco and all. This is quite rampant in Goa. And thyroid cancers also is more detectable because the tests also are now become more advanced where we can detect them early. And nowadays with a lot of information going into the public, a lot of people are aware. They see a small ulcer in the mouth, they come quickly. And because the system is such that in India, a simple patient can directly go and visit a specialist. So they can come direct to me, not unlike in some countries where it has to be routed to a general practitioner first, who will first treat, then he will give an appointment to a specialist, which will take around 3 months. But in Goa it is, or in India I'll say, it's very, very good for patients to directly come and show me. And we detect them fairly early, and if they are fairly well versed and they know that something is wrong with them. But we have seen the other side of the spectrum also, the very poor patients. They will be roaming with huge thyroids or like such big cancers. They're not aware only that it's a problem. They think it's something which will go away with just some medicines. And those patients fairly end up doing poorly because their stages are very advanced. But as far as possible, we try to give the best result from our side.
Optimum.
But finally it is
the absorbance of the patient and the love for a little bit.
Patients, this thing and
belief and absorbance.
That's very important because it makes a lot of difference in their healing and their recovery from surgeries.
Also, the timing is important.
Correct. They have to come early in the disease. But overall, we have seen that
things have got better.
Cancer is something which is completely. The luck plays a huge role. I have seen patients where they have never drunk, smoked, and got cancer. At 36, and why it has happened, they ask doctor, why did I get it? And then you have like no answer to give them. We don't know why. If you ask me why you got it, I'll say it's pure bad luck. So those kind of situations also have come. We have seen young, small kids also getting cancers, and then we have seen old patient living, smokers, drinkers living very well. But overall, we have seen that smoking, drinking increases the risk. There are certain risk factors which you have to try and avoid as far as possible. That's how it is. But overall, I'll say as far as cancer as a domain is concerned, it is growing because of a lot of factors, and it is detected early also because of a lot of advances, and you are getting good results also now. So now again, when a patient comes to me and says, "Okay, this is there," and you asked why, how do you treat this? You have to look at it in such a way that if I don't treat him, he is going to go downhill and he's going to die. So if you treat him, maybe he'll live. So you have to give your best shot, and he also has to trust you that this doctor will try the best. So it works that way sometimes.
It's both a cycle. It's like a timing, It's a coordination.
So the patient has to have belief. At the same time, the doctor says
has to give the best.
Has to give the best, and it works.
Coming back to my one crucial question, cancer has been threat to India, to the world. Where is Indian medicine placed right now for the cancer?
I'll say it's very good. According to me, seeing a lot of things going on in the world, the system of medicine in very advanced countries also is very poor.
Compared to India?
It's poor in the sense of accessibility. I'll not say as a whole India is doing well. As a whole India is doing very poorly. But a patient who can afford good treatment, who is willing to go to the lengths to get good treatment, can get very good treatment in Goa itself. I'll tell you my example when I went to international places and I've seen the surgeries there. The doctors there have operated, the junior doctors there have operated less than me, and I was just starting out. They have operated less surgeries than me. Means their volume is so little. The surgeon who I trained under has done 50,000 surgeries, but a surgeon who I went and observed thinking that they are in the biggest center in the world has done 3,000 surgeries. Now I have done 5,000 surgeries. So it is like I should be teaching you, not you learning from you. So the thing is, the experience of those countries is very poor because the junior doctors, because of so many medical legal things and so much less exposure to complex cases, they don't get that kind of exposure. When they see a patient who is operated 3 times, they don't know what to do. And here we are seeing it as junior level. So this is an important thing about India, where the Indian doctors who are good, who will take their profession seriously, who do their job properly and are trained properly, they are way better than international counterparts in terms of their work and their this thing. So people in India can get very good treatment in India itself instead of going out. And it will be 10 or 50 times cheaper than what they get outside.
Don't your hands tremble anytime while doing the surgery? Because I've heard that surgeons put music, they get accustomed, they want to keep their comfortable positions, and it's a crucial thing. And your is a abdomen, okay, it's a major thing, I can understand, but your is more delicate stuff. So don't your hands tremble? Sorry for this question, but I want to get into the practicality of a surgeon.
Yeah. But when we begin off, we are doubting ourselves. We are not sure of whether we'll do a good job. That time, definitely. But once you see a surgery multiple number of times, you are operating it with a technicality. You're not operating it like, directly thinking
spiritual, emotional.
You're not thinking that I'm going to cause this problem to the patient. No, you're thinking that I'm going to go with this good faith, I'm going to give my best, I'm going to remove whatever needs to be done, and it is going to be well. And after you've done that surgery at so many times, most of the things happen at your spinal level. It's like things are happening and
very nicely
yeah. So the trembling does not happen
once a practice, simple as that.
It happens.
And of course, as we say, every batsman goes to the crease. The first ball he plays, he trembles.
Like that,
no matter what happens.
Yes.
Okay. Have you maintained your statistics on this? How many operations of this kind? How many operations have you maintained that?
Yeah. So we used to maintain this fully in when I was in Kolhapur Cancer Center, when I was in Tata Memorial. In Goa, what happens? It's very diluted. You're not at one hospital. You're going to multiple places. So there's a lot of dilution, so exact statistics in Goa has not been maintained by me, but in Kolhapur and all we used to have a lot of statistics.
Okay,
we have like a complication rate, we used to see what are the stages we have operated, how many recurrences they have come, all those things.
Wow. Okay, in all, if I could ask you, how many operations till date?
How much it cost? 10,000 at least.
10,000, wow, 10,000. So you're like Virat Kohli of medicine on this levels, in Goa levels, and I'm not joking on that, because this age to achieve at this core, and of course you have the core of confidence where you go into everything and finish it off and nicely. And as you said, it becomes a practice.
Yes.
Rather than you're going to do something, it becomes a practice. You're a performer.
Correct.
You go on stage, you show, and you come out.
Correct.
When you're related on this.
So the surgeries, when you train at high volume centers is such that like I'll tell you my experience in Tata Memorial. We used to handle the minor OT on certain days. Twice a week we had to handle minor OT. So we had like 150 patients.
Oh my God.
Which we do in one day. Minor OT is where we have to remove simple things like removing stitches, something called as flap division, something called as small laser excision of the tongue. We do a stitching somewhere. These are minor surgeries. Patient comes in, 5-minute surgery operated. We begin at 7:30 in the morning. Used to go until 7:38, 9 at night. And 2 OTs running simultaneously. So you go and you do one OT, then you go to other OT till then that patient is shifted or other patient. So this is the volume which you used to deal with. So when you deal with this kind of volume, you've seen most of the complex things, and you've seen so many rare things which you don't see otherwise in most places. So I think that helps in also being confident to deal with things, and it also helps in deciding whether a certain thing will give good results or not.
So diversified performance, diversified cases you get to see in this way.
Yes.
You have done, there was a time when most of the doctors would go to Germany, go to US. With all this happening, if in normal case, if about say 20 years back and you had got to all this, then you could have been in Germany. And we say the medicine in India is, okay, reaching to the level, but best of the doctors in the world are belonging to India. At the top hates, correct, if I'm wrong.
I think the problem with most Indian places like ours, sir, also you asked me about have you maintained the data. So this is where most doctors do not do well in India, because the data is not maintained well. So in US they will do 20 surgeries and they'll publish 20 surgeries. In India they will do 2000 surgeries, but they'll not have data of
any one of
and nothing gets published. So then the doctor is like, this doctor is not known only, and that doctor who's done 20 surgeries is known because he's published it and it's presented it and he's gone to conferences and said, okay, I've done 20 surgeries, but there'll be somebody who's done
20,000 surgeries.
I'll give you a very good example of Goa. So I have a ENT surgeon from Mapsa, and this doctor, he sees ticks in the ear. Tick is a small insect, and he sees that he's seen so many. In India, I think most places they will see tick, and I also myself have seen, like in a year we see 1 to 3 or maybe at the most 5. This doctor in a year sees around 150 to 200 patients with ticks in the ear. It's that common. I mean, 150 is I think in the world over nobody must have seen. How to handle this, nobody must be knowing anywhere in the world. And he knows all the tricks. He says, this thing, not this thing, you should leave it alone. This one you should do this one you put this. And this thing is not seen other places. And that's what we see in India, which nobody knows.
Wow, what an example you have given. And you guys have, it must be your friend or somebody down there.
He's a senior doctor.
Okay. Your doctor career, the medical career which you've had, must have been approximately at least 15 years now.
Yes.
If I'm going by the age, 40 and 25, you must be a doctor. Yes. Any instance you would like to narrate to me or something like that, anything you remember in this 15 years which is very particularly happened or something like that?
So, like you asked, anything interesting, anything which you remember. So
any particular instance?
Yeah.
Yes,
so I will narrate one episode of our patient. So this particular patient was once one doctor called me to see him. He was a patient of another doctor, but this patient has come very late to this thing. The relatives had not taken care of him, and he was at the last note. He was an oral cancer, mouth cancer patient. He had such a big cancer. It was full, like a big ulcer here. All maggots, like worms. They had full maggots. And this patient, technically, if you look at him, he's thin, frailed out, not eating, nothing. He's considered terminal. But after admitting, we said, see, he's not looking good. We'll try our best. So the relatives also like, see, doctor, whatever you can do. Patient also was almost given up, so he's saying, I'm going to go, but let's see what you can do. So we had started him on things, antibiotics. We cleaned, debrided that whole area, removed the maggots, put the dressings. We waited for some time. His nutrition began improving. He showed a very good sign of improvement in nutrition. He started gaining weight. This thing also shrunk, the tumor was there. So after a while, I sent him for all the tests. We do test called as metastatic workup and resectability workup. So these are things where we can actually excise that tumor and is it spread anywhere. So after checking that, we found that it is not spread anywhere far. It is spread to the neck, which we can address surgically. So eventually, once his other parameters improved, we decided to take him up for surgery. It was a difficult decision to take because we don't know whether he'll make it, whether he'll do anything. Surprisingly, all the cancer came out after surgery, and he actually, when the report came in, that pathology report after excision, and we did a reconstruction for him. We put a flap. It was a long surgery. He came out of the ICU also very quickly. He started walking in few days, and that cancer which came out showed just spread to a few lymph nodes. So we were overall happy because the report is looking good. Here is a patient who is like, almost given up and is going to be terminal. Then we sent him for radiation chemotherapy. Won't believe this patient lived 8 years after that and died from natural cause, not from cancer.
Wow.
So it was an unbelievable thing for us also to see that something like this, which was almost going to go.
Wow.
He came back and he lived normal life. He used to come to follow up and he used to complain of other things. And doctor, I got cold. I said, cold is nothing. Doctor, stomach pain. I said, stomach pain is nothing. You have come out of cancer. So I think the important thing, take home message we learned from that is that everyone has a chance to do, to come out of cancer. He used to have this thing. First, that patient was very weak, but the moment he started feeling well, he said, doctor, do anything, I'm ready. Do anything, I'm ready. So patient also was ready, whatever it is.
The cooperation of the patient and the belief of the doctor.
Initially he had given up, but as soon as he started feeling better after basic treatment, he said, doctor, do anything, I'm ready with you, I'm with you. Whatever happens, I don't mind. Wow. So that made a difference. It made an impact that if things go well for a patient, and I think the luck, the God, whatever factors, all that play a role in this, because this fellow would have not lasted even a month, and he lived 8.5 years and died from some other causes. He died from other causes. Eventually died because of a quite old patient, but he didn't die because of the cancer.
Wow.
So I think this is one of the things which teaches you to not to give your best. Don't just give up and try as hard as you can. Like how you say in cricket, it's never over till it's over, till it's the last.
Yeah, but cricket is something entertainment.
Yes.
You all are real-time heroes. Cricketing heroes are a game that finishes off.
I think the
you all are real-time heroes. You are giving life to people.
Yeah, but logic applies that you have to.
We should take the logic from you rather than you taking the logic from us. Almost 25, almost 15 years of medicine, and there's a long way you have to go through more. What are your plans? What do you plan in your medicine, and what do you want to see the development of yourself, the growth of yourself, and the growth of medicine? What do you like to do further down?
I think I'll expand your question to encompass what you would like to do more in life rather than not only medicine. So now, as you have seen, I've gone into cricket. I would like to be good in cricket as well. And I have, in medicine, definitely I would like to be at the edge of the field, learn the latest, learn the best, learn from the best. As far as surgical fields are considered, they are a reducing field, I will say, because lot of things which were operated previously are no longer operated. So surgery per se is a reducing field. Even in cancers, surgery is eventually reducing. There are a lot of surgeries which were operated earlier now are only treated with chemotherapy or radiation therapy. So that's again going out of surgical domain, which is a good thing because nobody wants to undergo a surgery, and if you can avoid resecting unnecessarily and it can be treated medically, that is better. So surgery per se, techniques, I think I have learned most of the things. I want to learn the newer techniques in thyroid surgeries. There's something called neuromonitoring. There's something called RF ablation, which is started.
So you're in the process, you want to learn more things also. Yes. Okay,
so then eventually bring that to the local public, get it to Goa. Let's see how the results work here and give them a good result. So that is as far as the training is concerned. To training, you would like to train more. I would also like to impart knowledge, maybe teach some students, teach youngsters. So that's how I have also become the secretary of Goa ENT Association. And we are now conducting academic sessions and all for ENT doctors and all, getting international doctors to Goa to train, to give talks. And I've been associated with the IMA also, and I think I need to expand things in that. General doctors also bring awareness about how things needs to be done. Besides that, I think I'm also a sports person, so I play badminton, so I want to improve my badminton. I play cricket, I want to improve my cricket. And I think if you define me in one word, I'll say कि I always want to improve. I will always never see that there is an end to improvement. You always can become better than what you are, always.
That's a normal behavior or a tendency of a quality at which to have in a person who is the best, who always wants to learn till the end. It never ends. So I was just wanted, out of curiosity, when you were telling me all this and the way you want to grow big, I know the junior doctors look up to you. I want to know how your senior doctors, because you're like, example, I'm just giving like, you're like Virat Kohli. You're Virat Kohli of this field. And there is Sachin Tendulkar also, there is Sunil Gavaskar also, who have gone to different eras. How those doctors look up to this medicine and look up to you, what is the kind of respect they have for you?
I will put my side first. So you improve by looking at them first. So you see doctors when you are in Goa. No, Goa was a small place, so you used to only think Goa Medical College. You used to look to the professor and head of department Goa Medical College and to learn from him. So you start learning from him, and then you see a textbooks. This textbook is written by Prathamesh Pai. This textbook is written by Jatin Shah. These are big names. So like Prathamesh Pai. Then the next thing, you are in Tata Memorial, you are working under Prathamesh Pai, and you are learning from that person. You are learning from that person. You see his skills, the way he is operating. You learn those things, and then you imbibe his information, his principles. You learn from that. Then you go to Jatin Shah. In New York, I was working under a doctor called Jatin Shah, who was like the topmost in the world. So you're working under him. Then his principles. You have set in OPD, see how he talks to patient. You go to the OTC, how he operates. And those things you absorb. So that is how you learn from them. Then as your teachers see you doing well, they see you also performing, they also
tell you, this is what I wanted.
You're doing a good job.
Because that is the respect you're giving to them. Yes. That I've learned it from you.
They are happy. Like, okay, my that's my student who is doing this. They also gives, like,
This is the kind of thing I wanted to know whether it happens in medicine also.
Absolutely. Teachers are extremely happy when you do something, you get certain...
Or it's going into professional rivalries at times.
There are rivalries at certain places, but in the academic universe, there is not that. People want to do, and now the latest way of doing academics is to get publications. Means you do research and you publish it, because that is the cutting edge. You have learned theory, learned practical, then you have reached the edge of your field, and then you have to build new knowledge. So to build new knowledge, you have to do new research. So you have to build these things. So I'm also planning to do further research on multiple things. So there were so many researches which we did when I was in Kolhapur as well. So we should do on a flap. There was a flap research. There was one lymph node research. And I was on Tata Memorial. We published many publications. So I'm author of several publications, so more than around 15 to 20 publications. We have been part of the authors of certain books in evidence-based cancers. So that is also a thing to do, because but like they say, a person who does everything does not do everything properly. So that also you have to see. So you cannot give too much time to everything, and that way you will not become good at anything. So you have to decide what is good. So right now the primary importance is to your profession and your basic cricket, which you really like to do. Besides that, the rest is with family, and that's it.
So, Doctor, you have come from a surgery, and now you're going for a surgery. You have given me your precious time. I cannot be grateful to you more than this. Thank you very much. That is one. But before we end up, I want you to give two messages. I want you to give a message for the career-oriented people. That is the first message. A second message I want you to give to the people, general people, for this particular problems in life, of medical problems, cancer or something like that. So I want you to give two messages to people. What do you want to say?
So people who like to develop things, who like to go into learning, who like to be good at stuff, I think, like I just mentioned, the best take-home message would be improvement. Constantly strive to improve. So, and don't get stagnated. Just this, okay, little bit more. Even if it's 1% more, it's worth it by doing 1% more, even in any way. And that actually will take you forward as far as your career is concerned. But for general public, it will be basically more or less a health advice that, as far as cancers are concerned, the take-home message in cancer is, you diagnose it early, you are high likelihood of cure. You're having a very high likelihood of cure. So always, if you have any doubt anywhere that there is a cancer thing involved, get it tested as soon as possible and get it treated as soon as possible. So I'll give an example how patients do in Goa. So what happens? They come to me. I said, this is looking like cancer. Then they go and tell at home and tell 20 relatives, cancer. What do you do? Go to Bombay. So then the patient is next week, he's booked a flight to Bombay. Then he goes to Bombay. Then there he'll meet one doctor. That doctor will say, this is looking like cancer. You'll need to do biopsy. So when we'll do biopsy, doctor, you come 5 days later. So 5 days later, the biopsy is done. Biopsy takes around a week for report. He is now going for the report. Then he's doing the scans. Then the date of surgery. See, this week is
already
full.
2-3 months are gone.
Yeah, this week is full. Next week is full. You come 2 weeks later. Because Bombay, the load is so high. 2 weeks later, 3 weeks. Tata Memorial load used to be 2 months. Our waiting list used to be 2 months. So patient used to be willing to wait 2 months because of Tata Memorial. But it was not worth it. Because if you don't treat you now, you're stage 1. 2 months later, you're stage 4. Even if you treat
it goes that fast. It goes that fast.
Yeah, it could go even faster than that.
My God.
That is the thing which used to happen. And then finally, because Tata Memorial has a policy that you do not make patients wait long because cancer is growing. You send them to trained doctors from their hospital. So I have patients who have come to me, done a lot of things, gone to Tata Memorial, the doctor there has seen, why you have come here? Go and meet my this thing doctor. You wasted 1 month coming to me. Go there and meet my who's trained under me. So then the patient has come back to me. After 1 month, from stage 1 to stage 4 is gone. Now this has caused him to have poorer survival, poorer results, maybe recurrences, which could have been avoided if he had come and first up and done it. So this is one thing which is there. The thing that treating at the best center will give the best result, but the more important factor is
treat it
early.
Yeah.
I think that's the thing for patients.
Thank you, Pawan.
Yes, sir.
Dr. Pawan,
Yes,
thank you very much. Nice having you at my show.
It's a pleasure.
Thank you very much.
Yeah, it's an awesome feeling to be here, to see your achievements and to talk to you. So thank you very much.
Thank you.